All right, so as we get started tonight, I want to thank everyone for joining us. Once again, I have the chat feature. Feel free to write your questions on there, and I'll do my best to answer them. Additionally, I'll open it up. There's 32 members in here, and as we go through, I may ask a couple of my guys to chime in, Nurse Becky, Mr. Shelgren, just to kind of for some pieces of the presentation that they are more versed in. As we go through here, my goal is to provide information. And so the purpose is pretty simple. I want to review the draft of the health and safety plan. I want us to have as a well-versed understanding as possible. And then I'm here to answer questions as they relate to our in-person teaching, learning model, and specifically how does it relate to West Vincent? These plans are written, and they're written globally. And so every building is different. Every building has its uniqueness to it. So how does it affect West Vincent? And so my goal is to answer questions that you have, and then do so in a really respectful and productive manner. So that's what I'm looking forward to. And we conducted an in-person session this morning, in-person focus group this morning with about 20 folks that came in, and we were down in the third grade classroom. So it was really productive. The questions were spot on, and so I anticipate the same tonight. Once again, that chat feature's on the right-hand side. Feel free to utilize that. I have the QR code. It's on every slide. It's the same QR code. What I found helpful working with teachers and now working with parents this morning, and I'm going to ask the same from you. If you have different thoughts and questions, and you might not want to ask it in this forum or, put yourself out there, do me a favor. If you scan that QR code, it'll take you to a Google form. Feel free to share your thoughts on that Google form. And then what it does is it allows me to take the thoughts that are specific to West Vincent. I'll be able to synthesize those type of responses, questions, problems, concerns. And then I can go back through and try to tailor some of my responses to the group. Okay. And then additionally, as an elementary team, we'll be able to take the elementary concerns throughout the district, all 5 buildings, because there are similarities. I guarantee a lot of the questions that you have are the same questions at every level. And I dare say probably at every elementary school across the country. So it's not unique in that respect, but it does give a great data collection form for us. So please feel free to use that as we go through. And once again, the QR code is the same on every page. I really want folks to understand, as we go through here, we haven't made decisions in a vacuum. And I know there's a lot of chatter out there that we're sitting around making things up or something along those lines. I won't read all those, but I really need folks to understand that we take our direction not only from CDC, but really the Pennsylvania Department of Health, the PDE, Pennsylvania Department of Education, and we are most tied to Chester County Health Department. In fact, if you go through, and I'm sure many of you have gone through the health and safety plan, if you also log into the Chester County Health Department and look at some of the recommendations they're making for schools, you will notice that their document, which I have right here, their document is the same. You'll see the language is almost verbatim and throughout our health and safety plan. So it's really important to know that as changes occur, and they occur daily. That's the other thing I think folks really need to understand is, we're creating a plan that changes daily. And anyone that does any type of planning knows when you have to change what you do almost on a daily basis, it does become a difficult process at times. So with all that said, of course, we also had a conference this afternoon, or a press conference this afternoon from the governor's office and the Pennsylvania Health Department, and they even made changes as we speak. So things that I'm talking about today, there will be changes that need to be done, and those will be reflective as we continue to move forward throughout the process. Okay. So these decisions are not made in isolation. Additionally, the Chester County Superintendents, they meet weekly and discuss, and so there's a exchange of ideas. As principals, we meet not only within O&J, but we meet with our colleagues through the CCIU, Chester County Intermediate Unit, so that we're working in conjunction as well. And same for nurses. So each of the stakeholders, we meet several times throughout each week to make sure that we're kind of operating on the same page and doing some things that are similar. Every district's different, but the overall safety plan is going to be relatively the same. Some key considerations. I think we can all agree that having students physically present within the school is the way to be. It's the ideal, it's the normal, it's what we grew up with, it's what our experiences have been, okay? I don't think I'm saying this isn't rocket science here, where I say that students in school, that we're better able to access support services, appropriate education instruction within that classroom setting, not to mention all the social and emotional components of our setting. Students in schools, we have better access to the food security from the cafeteria, the social emotional learning, and obviously the physical aspect of just being in school. With that said, everything has to be done under coming into a safe environment and making sure that we can maintain a safe environment. So the phases, I think we've all, as parents, and remember I have 3 as well, so I'm going through this just like everybody else. I think we're very familiar with the color phases now. Red, we're all out. Yellow is much more stringent, and obviously green is even becoming a little bit more stringent as we speak. But for school, green phase, our goals are to have students in 5 days a week, and really emphasizing our basic screening processes, social distancing, hygiene. Something that changed as of yesterday. I know there's been a lot of talk about the hybrid model. There's no hybrid model for instruction. We operate from Pennsylvania Department of Education, and they too came out with some guidelines yesterday that allow us then to explore what a hybrid model will look like. And so, like I said, that came out yesterday. We were informed of it this morning. And so that's our next thing that we will be tackling, is looking at what does a hybrid model look like here at O&J. When do you implement it? Can it be implemented in any of these phases, whether it's green, yellow? And then obviously red, if we go to red, that's when we're going to be out completely and be total virtual, okay? Mrs. Zimmerman, great question. Do I anticipate Chester County being out and on the same page? That I don't know, because you could actually have a school that's out. You could a school within a district that could be out. You could have one standalone district out. I think the conversations as soon as one district has to go out for whatever reason. Obviously, if it comes from the governor or PDE, those are pretty easy decisions. They'll make that for us. But between the school board, superintendent, I think those discussions would happen. So, for example, if Downingtown were to go out, that's a natural discussion. If Downingtown goes out, should O&J go out, or should just West Vincent go out since of our proximity to Downingtown? Those are the type of questions that will be ongoing, and obviously that would be happening at the administrative level, state level, and our county level. So the possibility is, you would think it's there. But once again, each situation could be independent of another. Multiple school districts in Chester County are providing 100% virtual as an option. Does O&J plan to do that? I'll get into that in a second. The short answer to that is yes. Well, look at that. What a great segue. Here we go. Instructional plan for Cyber Academy. Please know that our goal is first to get a baseline for a health and safety plan. Some inside information. I don't know how inside it's going to be, but next week the curriculum committee will be meeting, and Mrs. Munson, you can forgive me, I'm having a brain cramp right now. It's either going to be at Monday's meeting, or if it's a standalone committee meeting, where the administrative staff and curricular staff will be updating the school board as to the Cyber Academy plans.
Yeah. If you want the latest and greatest, we're actually still discussing when that workshop will be, because we discovered that we had two board meetings scheduled for the same day, and we expect them both to go long. So we're still deliberating whether to leave them on the same day.
So that information
that will be on the website. Yep.
Thank you, Mrs. Munson. And so as that information comes out, that'll, as that presentation goes to the school board, that's your first glimpse into what the virtual learning will look like here at O&J. And once that takes place, our goal is the last week of July and into the first week of August to conduct specific focus groups throughout the district. There'll be one here at West Vincent that is just going to pertain to the virtual learning. Okay, so more information will come out over the next week, and then definitely over the next 2 weeks, that information will be communicated to the community. Mrs. Buck, great question. I'm going to answer that as we go through. Oh, good. Your questions are rolling in. Okay, I'm going to keep going, and I'll be able to answer them as we go. So if you look at the health and safety plan, it really breaks it down into cleaning, sanitizing, disinfecting, and ventilation. So some key points, and Mr. Shelgren, I will ask for your input here in this section as I go through it. But it's really important to know that each building will have a daytime housekeeper. So for us, I'll say Mr. John is my maintenance guy throughout the day, does basically everything I need from 6 to, he leaves me at 3 or 2:30. And then our evening housekeeping crew comes in and does our evening clean. So, and additionally, what we're going to do throughout the day is have a housekeeper on there, and that person's responsibility is to really hit the high touch areas, heavy traffic areas. Think about anything as a student, think outside the classroom for right now. So your frame of mind is outside the classroom. So that person would hit our high touch areas, doorknobs, hand railings, fountains, bathrooms, sinks. So I want you to think anything that a child can touch outside the classroom, that's kind of like a rotating throughout the day. Additionally, we'll have a scheduled for that person that when, so another example could be, fourth grade's going to lunch. And so for that 30 minutes and plus maybe recess. So for that time period, housekeeper will be able to rotate. Those rooms are empty and do a quick wipe down throughout the day. And then also help out in the cafeteria. Scheduled runs throughout each of our bathrooms that students and staff access to make sure that they're kept up and wiped down. So the goal is for that daytime housekeeper to really hit as many of the areas that students touch throughout the day. All the water fountains throughout the building are turned off, only the bottle fillers. So students will be able to refill their water bottles. I use them right now. In fact, I just filled this one up. It's almost gone. So those are still in use. Ventilation. There's a lot of discussion about how do we ventilate the buildings and the air, and how do we with filters. And so, Mike, if you could do me, or Mr. Shelgren, if you could do me a favor and touch base and explain the ventilation system and our approach.
Sure, Mr. Smith, can you hear me?
Yes.
Okay. Just to give a basic summary on how our systems work. So every day, Monday through Friday, our systems come on shortly before staff arrives. They run all day, and then they shut down right after staff leaves. And we on a typically we only run the equipment as much as we need to save energy. The changes as the equipment runs during the day, it pulls in outside air a certain percentage per hour, and it exhausts air from occupied spaces. So over a course of a day, it exchanges the air in the building a couple times. The changes we're going to make going forward is we're going to bring these systems on a couple hours earlier, and we're going to run them later into the evening. So what that will do is that will allow the building flush, if you will, like before anybody even arrives for the day. The air will be exchanged on time where it flushes the building. It's running all day long, continually flushing, and then in the evening, that flushing continues after everybody leaves. So basically, we're exchanging as much air as possible through the building throughout the day when people are there, and before and after. On top of that, we also are putting a fresh set of filters in the entire school district, all the HVAC equipment, right before the start of school, and those will be changed on a regular basis.
Mr. Sjogren, can you get into the rating of the filters? Because I know we're going to do the highest we can for the system that's in place.
Yeah, the not to get too technical, but the filters that we use are rated MERV 8. That's MERV 8. We actually had an engineer look at our district to see if there was any suggested changes to our filters. And what the engineer recommended is that we stick with the MERV 8 filters because that's what our equipment is designed to run on. Putting any other type of filter in there, we run a high risk of damaging equipment, and we won't get the correct filtration. So the recommendation is not to change the filter, but run the air through the filter more cycles to clean the air that way.
And I was just going through some of the questions, Ms. Sjogren, and forgive me if you already mentioned this, but a lot of questions had come up both on the survey as the time, the amount of times that we change the filters, and then the other question is windows and rooms that don't have windows. If you could talk about how the system works, it's more efficient when the windows are closed, and the rationale behind that.
Yeah. So I believe there's only very few rooms in a building that don't have operable windows. But that being said, windows can certainly be open, and teachers have always done that. They've opened windows, closed windows. But I believe it's really giving you a false sense of security opening a window, because in a cracked open window, you're not getting a whole lot of air exchange back and forth through the window opening. The air exchange is really coming mechanically with a fan drawing the air in from outside and exhausting the fan, or exhausting the air with a fan. That's really where we're going to get the fresh air and move the air through the building.
Additionally, some of the things in the plan, additional disinfecting high touch areas, I touched upon that. If there's a confirmed COVID case, building quarantine, tracing will be done. We're very fortunate the district had foresight even into last year of getting the electrostatic cleaners. We have a few of them in the district. I don't think you can even purchase them right now. They're in high demand. So we're ahead of the game in that respect. And then obviously the building's re-inspected before anything or anybody can come in. Okay, there's some questions on, I'm going to try to start at the top and hit a couple of them as we go. The instructional things that start as far as Cyber Academy. I know some folks are asking on there about the hybrid approach. Bear with me because we just learned of the hybrid approach. We had some ideas and have talked about it, but we really need to kind of flesh that one out. But I would anticipate whatever route you as a parent decide is best for you and your family, whether it's the cyber approach, whether it's sending into school, there will have to be flexibility. I will get into that a little bit more in detail as we go through. But some of the questions are, if you start off in virtual, can you come back to brick and mortar? The answer to that is yes. If you start off at brick and mortar, can you go to virtual? The answer to that is yes. Remember, we are a public institution, so I have kids that come and go all the time. I'll get into some of the medical pieces, and I'll ask Nurse Becky to help me with that when I get there. But bear with me, I'm just trying to read through. Is there a plan to limit the high-touch areas like the cafeteria? I'm going to touch base on the cafeteria and some of that in another minute. When going through this section of the survey, we had about 150 respondents, 148 respondents from West Vincent, and overwhelmingly from the survey, some of the feedback that I received, limiting the number of children allowed in the bathroom at the same time. We will end up having to do that. Everyone needs to take a step back and think of all the normal routines that we have had here at school. And trust me, I've gone through the day a million times to think about these routines and things that we take for granted. I want everyone to take a step back and know that at one point we would stop after, take first graders. First graders, we would stop after recess and they would use the gang bathrooms, and then they would rotate classes through there. In that 10-minute window, kids had access to the bathroom. Those type of routines we're not going to be able to do because part of our plan is to limit the amount of traffic in the hallways, limit the number of children that are in the bathroom at one time. So those type of routines where we would send kids and be there in mass, those will have to change. If a child's in the classroom and needs to use the restroom, they will not be limited. They will be able to use the restroom. As I said this morning, if a child needs to use the bathroom, they're going to be able to use the bathroom. The ventilation system, I appreciate Mr. Shelgren going through that. The other thing to think about at the elementary level is really the communal sharing of materials. And that's huge. Think about all the things that's why I haven't sent out supply lists yet, because I'm not sure how we as an elementary team want to approach that. Because obviously all the things we used to send in for common use, we're not going to do that. I fully anticipate having each kid have their own supply of materials. And so what those look like, I want to make sure I keep them as minimal impact on parents as possible. But the things that we used to share all the time, pencils and erasers and glue, those type of things, you can know that that's going to be down to a one-to-one basis, meaning for that particular child. Transportation, that's an ongoing discussion. And so if you think about when we register for school, there's going to be some things coming out where parents, you have to make a decision whether you're going to start off in a remote setting, if you're going to send your child brick and mortar, if you're sending brick and mortar, are you going to utilize transportation? Those type of decisions, we're going to ask your input on so that we can get a gauge as to how many are going to be in the actual school, how many will be in virtual, and then how many folks are planning on using transportation. For our particular building here at West Vincent, that does present another unique challenge for me, because I anticipate that the number of folks driving their kids to school will increase. And so sometimes that spacing here at school becomes interesting. So I'll have to have a plan for that once I get an idea of the number. And once again, parents, you have the option of starting virtual, coming back, or coming in here and then leaving. Remember, the phases are going to be important as well. I do see that Dr. Lloyd has joined us. Good evening, Dr. Lloyd.
Hello, Mr. Smith. So good to see you.
She spent the morning with me too, so we'll bookend her day maybe.
No, my day is far from over.
I was hoping I could bookend your day for you. What couldn't get better than that?
Every day is a great day at West Vincent.
So the one question that came through is, will bus drivers be trained? Becky, I'm going to jump, or Nurse Becky, I'm going to jump off on this a little bit. Our bus drivers are really good at letting us know if a child's not feeling well. They'll radio us in. Typically, that's very evident because the child either was sick or it's just evident. And so our drivers are not going to be taking temperatures. The drivers aren't going to, be asking questions of the kids. We are asking them to be mindful. And so if they can tell a child's not feeling well, radio us in so we can scoop them up to make sure that they're okay. As far as temperature checks within the building, I'm not going to be doing temperature checks on students or staff. However, if I know that we have a child that is compromised in some fashion or another, whether diabetic, health concern, you could go through the myriad of concerns we have. We will take the temperature of that staff member. And we would work with parents if there's a need for a particular child, just to maintain that atmosphere. Becky, do you want to take a minute or two and just talk a little bit about some of the things that our nurses are going to be doing?
Sure. So, nursing, just like everything else in the district right now, is we're meeting very frequently. We're having continuing conversations about what is the best approach for screening, for temperature taking, for illness as it occurs in the buildings, both students and staff. And we're taking our direction, obviously, from the Chester County Health Department. if you look at our building, we are nearly 600 students in our building. The feasibility of me taking a temperature on every child as they come through the building, even if I had 2 or 3 helpers to do that, would significantly delay the end of the day, and really use my skills not efficiently. We know parents send their children to school sick, but they also pre-medicate them with Tylenol. So most likely if they're coming in sick, they probably won't have a temperature because they've been medicated. As well as studies are showing only about 30% of people that are infected with COVID-19 have a temperature. Many of those people aren't presenting with temperatures, it's other symptoms. So it's not truly an effective use of my time or anyone else's time in the building, which is why we aren't looking to do mass screening with temperatures. But as Mr. Smith alluded to, we are going to be taking temperatures for students that we consider high risk. We will discuss that with the families of those students, as well as the staff that are working closely with those students. So we will be monitoring the temperatures of them. As far as, this is going to be a village taking care of our school. So we're asking you as parents to be very vigilant about checking your children. Part of the screening process is asking parents to take the temperatures of their children at home before they come to school in the morning. We're looking potentially at maybe apps or some sort of a documentation that this was done. Again, that's not something that we've nailed down. It's considerations at this point. But again, we're looking to you as families. If your child's not well, don't send them to school. Currently, we have a list of symptoms that I need to exclude with just one simple symptom. I have a list of symptoms, whether if you're approaching me in the office with 2 symptoms or more on a list, I would need to exclude. But we spoke about this morning as well. We're going to look at this on an individual basis as a family. If you have a child that has a chronic health condition, that they are always congested, or they have a chronic cough due to asthma, we're going to have conversations with you as well as your medical providers to be sure that we're not sending a child home who has chronic cough thinking it's COVID. So again, it's going to be a team approach. As many of you know me, I'm very transparent. I love to communicate with you. I call you all the time. I'm going to be having these conversations. I want you to know that I am there present. Mr. Smith is present to answer these questions as we go along. But again, this is a fluid process. Things are going to change in the next 6 weeks. But as it stands today, we aren't going to be taking the mass temperatures, but we are going to be addressing the students as they come into the building, as well as professional development for teachers. We're going to be talking to them about, if a student comes into your classroom and they look ill, many of us know what a sick child looks like. They're immediately going to send them to my office. We're going to ask questions. We're going to call home. We're going to go through this process of early screening as soon as they enter the building. And again, as Mr. Smith said, if a student gets on the bus and is coughing all the way to school on the bus, that bus driver is going to let me know as if they, if they vomited on the bus. We're going to have these dialogues with bus drivers as well. So again, it's going to take the village to do this safely and in a healthy manner. And again, working together as a team and treating every case individually.
We'll come back because I know, Nurse Becky, there will be other questions. Just parents, I just need you to know that we're going to use a lot of common sense as far as if there's chronic type things, allergies. And so that kind of discussion will be ongoing. We don't want to be calling parents every day, pick your child up, you got to go to the doctor, because the doctors, let's be honest, and if they're the nurse practitioners and Mrs. Zimmerman, you can holler at me on this if you want, but they're going to be doing a lot of different screenings. They're not going to want their offices overwhelmed with patients because the school said so. So they're going to ask you the screening questions. Have you been exposed to COVID? Has anyone in your family been exposed? Has anyone been diagnosed with COVID? The telemedicine has really picked up, and I'm sure that's going to be where a lot of these offices go. So those type of questions, you're going to be on the phone with your doctor's office, and they'll probably guide you and have a step-by-step directions for you as parents. And so we're going to work with you. We're going to work with our local pediatricians, and so that we're kind of all operating on the same page. We do a lot of that now, and it was in the background before, but some of that stuff will kind of be front and center. The $1,000. Go ahead. I'm sorry.
If I can just add, there was a question about testing, and would we be referring you to particular testing sites? We would be directing you to your pediatricians. I believe, as this is such a fluid thing, your pediatricians are going to know which are the best testing sites for your child to go be tested, whether that's their office. We are not going to be making those recommendations in that, nor are we going to be doing testing at school. We do not have a point of care rapid test that we can do in our school buildings.
One of the $1,000 question right now is masks, okay, and why the plan didn't say something about masks. Well, I want you to remember the mandate came out, our plan was already sent out, and the orders were changed. So yes, students and staff will be required to wear masks, and that itself lends it to a whole host of discussions. And so once again, I ask parents to take a step back and think about our routines that we've done in the past have to be different. I know if your kids are anything like mine, I have to constantly remind my guys when we leave, do you have a mask? Do you have your mask? Why do I have to wear it? Because I said so. I know we've had those discussions, and I'm not unique. I see some people shaking their head yes. Here at school, I don't want masks to be to the point where it becomes the number one issue. Kids are going to be required to have them. When they get on the bus, they're going to be encouraged to wear those masks. Remember, the dialogue has changed, though. It isn't Ed Smith, the principal, making your child wear a mask. It's you as parents. It's us as a county, as a district. We're all in this together. I have to wear the mask. I do have these fancy shields, and I have dividers. See, I had this on this morning. It's not too bad at all. We'll have those for staff. We have dividers for small group instruction so that the plexiglass can be there so that instruction can take place. You're gonna see that there's natural breaks within the day that your child's gonna want to take that mask off, drink water, eat a snack, lunch. But there's going to be times when they're transitioning throughout the classroom, transitioning throughout the building, they're going to have their mask. How I have equated it is pretty like within the room, the iPads, the teachers will say something like iPads up, meaning that they flip their iPads over and they have access to them. iPads down, it's put away, it's face down. I think you're going to see where there's going to be natural breaks throughout the day. Mask off so that they can get their masks off, or mask on where we're on our way to lunch or we're on our way to specials. So I think as we go through the discussion of masks, right now they're required. If that changes and the guidelines change, well, we'll act accordingly. If a child can't wear a mask, because I'm going to have some that can't wear a mask, that to me is a medical thing. I have kids in this building that have sensory type issues, and the mask they won't keep it on. Those that have younger kids, think about your 5-year-olds, your 6-year-olds, maybe your 12 and 13-year-olds. Getting them to do just about anything sometimes can be a battle. But I think the routines that you've established at home for when you go out and the mask is required, it's going to kind of help us enforce or encourage our kids even here at school, because they're hearing it from you, they're hearing it from us. But at the same point in time, I think we all know that if you wear that mask for 7.5 hours, that's hard. And so there's going to have to be some natural breaks where kids can kind of take that mask off to have their snack or have their, drink some water. As far as, on the bus, you can see from this right here, some of the questions I was trying to anticipate. I talked about it a little bit ago. Could a single building be closed? Absolutely. West Vincent could have to shut down, but the other 6 buildings within the district could stay up. Whereas, it could be 2 buildings, it could be 1 class. It really depends upon what takes place during that time. Ventilation on the bus, we are going to have windows open. But once again, I really want to use common sense. If it is 0 degrees or below 0 outside, maybe that window's just cracked. I'm not interested in freezing kids out or, making sure that nobody catches a cold because the windows were open and the bus is going home. Right now, the current guidelines are 2 to a seat. Once again, though, I anticipate that parents are going to want to be bringing their kids to school. So that piece will be, and as we go through, and we'll have every child will have a seat. Social distancing. I know that there's been some discussions out there about 6 feet versus 3 feet. The Chester County Health Department, once again, they do mirror CDC, and they talk about 6 feet as the goal, but they also say 3 feet is the minimum. So I have set up this morning. I had it set up our whole third grade. I have them set up at 3 feet. One of the things that it's going to necessitate are some of the tables and some of the other things that teachers have in their rooms. Though I've already taken most of those out. But when it's not desk to desk is the 3 feet, it's really nose to nose. And so just with the current setup, it's around 4 feet separation between kids. And that's with 25, 26 desks within that classroom. So those type of things are going to be constantly reevaluated on how to set the room up. I want you to think, and I might be dating myself, but I want you to think kind of old school, desks in a row, kids facing forward. That's kind of the environment we're in. And so that's the way the desks will be set up. And so that's kind of how we'll approach just within the classroom setting. Face coverings will still be implemented within the classroom setting. Once again, I think the teachers will have to create their own management technique. If a child decides they're not going to wear the mask, right now, I think that's just a discussion point then between the teacher and you as a parent. If it becomes disrespectful or obviously there's a safety issue, I think then the discussion then kind of rises to my level, and between myself and you, we will come up with a good method there to fix it. As far as the hallway and getting from point A to B, staggered times for lunch, staggered times for recess. I have to think on how that's going to work, as well as arrival and dismissal. So those things are going to look different than in past years. Cafeteria, I'm going to add right now, going to our minimum of 3 feet. I've kind of spaced it out where if we look and we get one grade level, second grade goes to lunch, it would be just second grade in the cafeteria. I'm looking at times. Most of my 4th, 5th, and 6th graders, after 20 minutes, I mean, the last 10 minutes is really pure kind of behavior management, for lack of a better way of framing it. But really, after 20 minutes or so, kids get a little rammy. They're ready to go out to recess. So I'm looking at that piece as well. But definitely having one grade level in the cafeteria is my approach. Every other seat, that gives us plenty of space within the cafeteria to house that grade level. If we get to the point where it becomes more restrictive and lunches are within the classroom, I think the natural discussion would be really we have enough allergies and peanut allergies and nut allergies within the school that the conversation has to be had about do you just go totally nut free, especially if you're within a classroom setting. Those things we'll have discussions with as they come towards us.
Mr. Smith, there's been a lot of questions that came through the chat room regarding a lot of what we just went over. If you might want to look at those.
Yep. I do want to be mindful of everyone's time. So I'll go back to the questions in a second.
Okay.
Social distancing, once again, we've talked ventilation and the cleaning between throughout the day. A lot of parents are asking about a schedule. That is absolutely going to be part of it. Mask enforcement, we talked about. Common areas, I got that pretty well situated. The upstairs common areas, guess what? No longer exist. That's actually going to be 2 classrooms, so we have that one cleaned up. Okay. The one thing that it's going to change is our PTA events. I met with the PTA the other night, and a lot of the things I said, keep every event on the calendar for now until we absolutely can't do it. But for those that have been in the building before, our very first kickoff is our back to school bash, and there are a lot of people here for the back to school bash. We have to have long discussions as to what does that look like? Do we have to break it up? Can we put it on? Can it be done safely? So those are the type of questions moving forward that I think we're going to have some realistic conversations. One of the things I talked about this morning, and I don't want to lose sight of it, and really it's about opening the school. We haven't had students in the building since March. Teachers haven't been in the building really since March. And so I think before the first day or two, you have those get to know your class, get the routines down for that class, learn what the expectations are from that particular teacher. I think my gut says after 20 some years of doing this, that's going to take a while. We need to get kids in here, make them comfortable, make sure that they're comfortable, make sure you as parents are comfortable with what we're doing, make sure my staff is comfortable with what we're doing. But really it's to make sure that your kids feel safe in this building. This has been a building of safety. This is a structured environment. It's a safe environment. They need to feel that. You as parents need to feel that. Not to be all touchy-feely, but those are really, really important, and I don't want to lose sight of that. So I think we are better served by spending time making sure that students feel safe, comfortable. Things that are going to look great on paper. Once I have students in the building, teachers are going to say, you know what, Mr. Smith, that's not working. We really need to switch it up so this works. You as parents, you're going to give me feedback that's saying, yeah, I think that's going well. However, you might want to look at dismissal. We need to do something different there. So the conversation is going to be ongoing, but the comfortability for students is really important, not just to me, but to staff. When we met yesterday, they voiced that overwhelmingly. So just some questions that I was trying to anticipate. I didn't talk about this earlier, but we'll have in every single classroom will be basically a gallon jug of foam hand sanitizer. Okay, so I know parents, if you have some, you'll be sending that in, probably for your child, obviously. But I also have one for every classroom. Every classroom has a sink. That has a sink has a soap dispenser. There's soap dispensers in every sink in the building, bathrooms. Teachers will have disinfectant and different things that they can use to kind of wipe student desks down in their work areas throughout the day. I talked about the social distancing as far as cafeteria, walking through the hallway. Additionally, parents, I don't know about you, but those Clorox wipes, as soon as they come on the shelves at Target, they seem to disappear just as quick. So Mr. Shelgren is going to provide each classroom with some disinfectant and some paper towels so that we can keep that throughout the school day within that classroom setting as well. If you think about the setup of the building, the entrances back by Mr. John's office, the access road, that entrance, the main entrances from the recess macadam into the cafeteria, into the gym by Mr. Heinemann's office, and the front office. Those four main areas, we will go ahead and have installed dispensers out on the outside for hand sanitizer. Those will be on the outside. So we've added those. Staff temps, we've talked about that, and we talked about students. Let's talk a little bit about, before I get into monitoring, let's talk a little bit about the instructional program. One of the things that I know was coming up on the chat, going back and forth between virtual or brick and mortar, we touched upon that, that will be acceptable as well. Flexible attendance policies, anything that deals with policy. I know that Dr. Marchini and Pupil Services are looking to add some language to the existing attendance policy, but those will go through the normal business through the committee, the policy committee, and then the board will have final approval over any changes to policies, or especially having a flexible approach to attendance. That will go through the school board. Let me go through two more slides, and then I'll go back and just really open it up to questions. Dr. Lloyd, I know that you're kind of in 3 or 4 different spots. Do you want to say anything as I keep going?
Thank you, because I was going to interrupt. I didn't want to be rude while you were talking, but you're right. I do have to jump into the next task force. Somebody's mic needs to be muted. But parents, what I want you to know, this is what I want your big takeaway to be, is that you have choice. We are so fortunate that we are in the Owen J. Roberts School District, where we are able to offer you choice. And I want you to make the choice that's best for your family. We have got to educate all students. What we're presenting is our health plan for in-person. This might not be the right choice for your family. Make the choice that's best for you. We're planning for all students coming back. All students aren't coming back. That's how we're going to get more distance in our classroom, because we're hoping that parents are going to choose the Owen J. Roberts Cyber Academy, because it's going to be taught by our teachers. It is going to be in pace with our curriculum, so that when you have to choose a cyber option, because I have to say, folks, I believe we are all going to be virtual. And it may be coming sooner than later. We heard today from the health department, we heard Dr. Levine today caution Pennsylvanians about the increase in cases that we're seeing, and that Pennsylvanians need to be wearing masks, or else we are going to more restrictive measures. And they've already put in place more restrictive measures in our state. So I want you to make the choice that's best for you and best for your family. If your choice is to come in person, I want you to know that we are going to keep your children safe. We do each and every day as if they were our own. If it's not for you, it's okay. There are other choices, other quality education, such as the OJR Cyber Academy. And just the other day, we learned that we'll be able to create a hybrid option that I'll be talking with the school board about next week. I invite you to join the school board at 6 o'clock on Tuesday virtually. The link is always on our webpage, because that's when you're going to hear the school board talk about our Cyber Academy that's going to be rolled out to you at the end of the month. And so you'll have an opportunity to attend an open house, multiple open houses for the Cyber Academy. If that's the choice that's best for your family, then make that choice. But it will be O&J teachers, it will be the O&J curriculum, and your students will be able to move between an online environment to the classroom environment, if that's what we have to do. The pacing will be the same, the curriculum will be the same. And so I hope that you leave tonight getting your questions answered. I know Mr. Smith is going to stay on as long as he can. And if he can't, he's going to answer them in email, or he's going to talk to you on the phone about this. But I want you to change the narrative in our community. There's too much hate. We must all keep each other safe in our community. We all have a responsibility to take care of one another. And we can do that by choice in education this fall. So next Tuesday, tune in. You'll get to hear what our school board's going to talk about with the Cyber Academy. And then you're going to also get to hear them start to kick around ideas for a hybrid option. So I got to jump off. I got to go to the next meeting, folks. Thank you so much for your input. It is so important to us. You were invited tonight to this meeting because you read our plan. And we want to have dialogue with parents that have read it and can give us feedback on what's best for their children. So thank you so much. And I look forward to seeing you again. Be well, everybody.
I'm going to hit a couple of things right now from the questions. One of them was on drills, and I had that in there. I forgot to talk about it. At the end of the day, when we do our drills, I will conduct drills, unless obviously if the state says that you're not to conduct the drill. Otherwise, we will. If I had to do a lockdown drill, or I'm sorry, even just a lockdown because of an issue, social distancing, mask wearing, those type of things, to me, that goes out the window. My first responsibility is to make sure that if there's a threat to students or staff, that's dealt with immediately, and then we'll worry about social distancing afterward. If I have to evacuate this building because of a fire, I'll worry about social distancing once I get everybody out of the building. And then I got plenty of space around this building to spread everybody out. So like, I cannot anticipate not practicing a drill, but if it is a drill, we'll use some common sense. But if it's a lockdown, then we have to practice what we would do. And so I would not go away from those, because the safety of that moment is paramount. So we would cross that bridge when we get there. I talked about if students can't wear a mask, then I'm not going to make it. I'm not going to force it, but that's a dialogue we would have together. Recess equipment. I'm kind of just hitting some of these recess equipment. Yeah, that's obviously an area that I'm monitoring because I'm struggling with it myself because I'm not going to have staff go out and wipe down the recess equipment. The balls, hula hoops, and those type of things I'll probably keep in, but just the actual equipment, playground equipment, I just, it's not reasonable or a reasonable expectation that I'm going to wipe that down. So we're going to have discussions about that. It's not just my building. We have 5 other elementary buildings. And so that's a discussion just system wide. What does that look like? What does recess look like? Kids also need to get out and stretch their legs. I can't keep them in a room in a bubble all day. That's not practical either. Let's talk about instruction, and I'm going to give you the example. Let's say second grade, I have 100 students at second grade because there's questions on class size and this or that. So let's just use round numbers. I got 100 kids at second grade. 25 parents say they're going to go ahead and do virtual learning. That leaves me 75 brick and mortar. I have 4 staff members. 1 staff member then would become that virtual learning teacher. I would then take the 75 kids and reshuffle them into the 3 rooms. And then if you think that through, let's say the numbers go up in 50 parents, and I'll say, I'm going to pull my kid to do virtual learning. And so I would then take another teacher. So there's 2 doing virtual, 2 doing brick and mortar. Once again, I would have to reshuffle classes. Just think about that. Usually this time of year, I'm doing class assignments and I have a pretty good handle as to where they're at right now. And so I'm tweaking from the last few weeks before we go live. You know, the hair is turning gray. I may have gotten a cut, but the gray hair, I'm going to catch Mr. Shelgren here in a minute. But honestly, those are some valid things that we have to talk about, keep in mind. And once we get to that point, I will definitely let parents know that, like, hey, we're shifting here, we're shifting there. But those are things that I think are impactful. A lot of questions about, a couple folks are asking me about the teachers union, if they're in agreement with this. Honestly, I'm not sitting in on those conversations. And those conversations will take place at the administrative level with Dr. Lloyd, the REA leadership. I'm taking care of my 75 staff members and my close to 600 students at this building and 1,400 parents. So I'm not real concerned with the teachers union at this time. That piece will be worked out. And so if and when that becomes an issue, then it won't just be an Ed Smith West Vincent issue. It'll be a district, but I don't anticipate that being a problem. Mrs. McGarity, you asked about the 14-day. Becky, do you see Mrs. McGarity's question right there? Becky, why don't you just talk about quarantine in general?
Okay, so if a student comes into our building and they are suspected for COVID-19, we will be sending them home with direction to reach out to your pediatricians for evaluation and testing. They will be asked to stay home until we have a negative test or a positive test. If they come back positive, they're going to be required to stay home for the 4 days. If we get a positive test in a building, we are then contacting the Chester County Health Department and they are giving us the guidance. As it stands today, if a student in a classroom is tested positive, everybody in that classroom will be notified that there is a positive case in their classroom and they will be asked to monitor for symptoms in their students. The question of quarantining that entire classroom would then go back to the Chester County Health Department and they are going to give us further guidance. It's going to depend on how much contact that student, were they there 1 day, were they there 5 days? How close were they to the other students? And the same if it were a teacher. If a teacher tested positive, what is that going to look like? So again, this is fluid. We have our immediate contact with the Chester County Health Department as to, his name's Bill. We speak to him directly and get guidance from him. There is a letter that will be sent home to you. Dr. Lloyd, as part of our plan, will also be communicating with you. If your child is indicated to be in close contact to them, you will be notified by the Chester County Health Department as part of the contact tracing, and they will be giving you guidance as to how long you need to quarantine, and what that looks like for your family. Somebody had asked the question, if your elementary student tests positive, then does the sibling at the high school mean the high school has to close? We aren't even looking if one case is positive in a classroom or in a building. It's not necessary that the entire building close. It may be that we shut down for 2 to 5 days and do cleaning. Again, these are all things that we kind of need to get into it and be doing it to see how it's going to go. But again, we are in touch with the Chester County Health Department, and they are giving us that guidance. We currently have 6 different scenarios that the nurses are working on, as far as if this happens, then they have to do this, and if this happens, they have to do that. That is a document that we're working on right now for summer school as well. So, we do have live summer school going on, and we're working through those documents now using that. As far as the nurses contacting you, we're not part of that contact tracing format, and we're not part of that making that initial contact to you. That's going to come to you from the Chester County Health Department. But we will be notifying you that there is somebody within your program that has tested positive. Obviously, we're keeping it confidential. You're not going to know which child or which student. That's, for confidentiality purposes, that's just not appropriate. Somebody asked the question, for COVID-19, those symptoms are the same as many other illnesses, Mr. Bowman. As I had stated earlier, yes, there's a very extensive list. We have a list of one in your home today, which could change. Again, we have 6 weeks until we're back into the building. But today, if you presented with a fever, 99.5 degrees or higher temporal, 100.4 degrees or higher orally, you're going home. If you present with a cough, with shortness of breath, or with difficulty breathing, any one of those symptoms, we're going to call and ask you to be picked up and evaluated and potentially tested by your pediatrician. The other list is 2 or more symptoms. So 2 or more headache, stomachache, headache, sore throat, 2 or more of those symptoms. We're going to be calling you, ask you to get evaluated. If your child has strep throat and has a fever and a sore throat, they're evaluated by your doctor. We're going to get that information back from you. It's not COVID-19, it's strep throat. We're going to then ask that they stay home for 24 hours, fever-free, on their fever-reducing medications. If it is a positive COVID-19 case or symptoms of COVID-19, then we're looking at a 72-hour exclusion from school until you're fever-free and symptom-free for 72 hours. So it's a little different, COVID versus just your typical illness. And we will be working with some typical illnesses. But again, that's going to be a lot of dialogue between you and me, Mr. Smith, and potentially your physicians as well. We will be asking for documentation if we send home a probable or a suspected case of COVID. We will be asking for documentation that they are able to come back to school. So just know that too. So we will, as much documentation as you can get from your doctors, we will be asking that of you. And again, I had mentioned it earlier this morning. If you have a child who has seasonal allergies and every fall they get the runny nose, the itchy eyes, the sore throat, the cough because of allergies, work proactively with your pediatricians to get them on proper allergy treatments or whatever that is for your family. Whether that means, they're taking an allergy medication every day. Be vigilant about keeping control of those symptoms, because you can see as a nurse, if they're presenting to me, I may have to call you and it could just be allergies. So again, as much proactivity as you can have with your pediatricians to manage the chronic illnesses. Asthmatics who have a ton of coughing, being sure that they're on their proper asthma medications, that they're using them consistently, that we have documentation from your doctors that this is a chronic cough this child has, it's not COVID-19. Again, as much as we can get from you, we can be sure that we're safe in the building.
Nurse Becky, thank you. I know I said I would be on till 6. I'll stay on longer as folks want to stay on. So if you need to leave, please leave. I'm going to just go back through the chat right here and try to answer any questions that I haven't hit upon already. A couple questions about wouldn't it be better to do yellow and wouldn't it be better to do this instead of going green? I will echo Dr. Lloyd and say that I fully anticipate what we're talking about right now today. And we're putting a lot of time and effort into planning for opening. I absolutely believe that that is going to change. And so I want to echo what Dr. Lloyd said. There's going to be options. And so you need to decide what is the best option for you and your family. So as far as I'm concerned, I will do whatever I need to do to keep kids safe. I will look at the routines that we have and everything that we've taken for granted since the time I've been in school. And so those will need to be reevaluated and looked at. And obviously I can't do it without staff. And some of the things that I'll put down on paper, once again, they're going to look great. But once I get staff in place and they're going to help me say, yeah, that's not so great, Mr. Smith, we need to change this. And so by working that together, we'll be able to create a healthy environment.
Mr. Smith, they're asking again about this possible infected child. So just to be clear, if we send a child home who we suspect and they're being tested for COVID-19, they're not allowed back into the building until that test result is back. So they're not in our building while we wait the 5 to 7 days for the test result.
Now, mind you, when that's going on, if I have to exclude a child or we have to quarantine or something, we also have our hybrid approach so that we don't lose instruction. So your child may come back with a positive test, and so you go through all that or symptoms or whatever the case may be. There will be options to go into the hybrid approach. I'm sorry, not hybrid approach, into the virtual setting. I know there's questions on what does the Cyber Academy look like. Those will start to come out next week. I want to say that again. Those will start to come out next week, as well as what the curricular pieces are going to look like. You'll hear that at the board meeting, okay? As far as the number of days waiting for the test and a positive test, I don't have control over that. Once again, I think you have to make decisions as to where you might go to get the testing. Some are quicker than others. I was told that patient first is not that quick, but your local pediatrician might be quicker.
Yeah, I've heard many of the CHOP offices have point of care testing and you get your results within 24 hours. People that are going in for surgery, they're getting test results back within 24 to 48 hours. So it really does depend on where you're getting your testing done.
Mr. Carroll, I want to go back to your question because I don't want that lost. So the question is will OJR teachers for the cyber option be provided additional training to conduct distance learning? I'm not sure what you mean by conduct distance learning. Oh, never mind. I was thinking of social distancing. I apologize. It's like they can't social distance on a cyber option. I apologize. We're going to use grade level teachers. It depends on how many kids are out. That's a hard question to say, but so in my example, I gave you that it was a second grade teacher teaching second grade. That's an absolute given. If 20 kids at second grade from the district are out, it might be a second grade teacher from a different building that provides the virtual learning. We're not going to increase staffing. That's not a reasonable expectation of the district. We will use existing staff. To answer your question, we have a whole host of PD that will be taking place. Our instructional coaches have been awesome. They've already been hard at work. So our instructional coaches have been meeting over the last 2 weeks, looking at our curricular pieces. We have teachers coming in throughout, I think they're coming in tomorrow actually, and into next week to take a look at some of the mapping part of it and scope and sequence. And then the PD in August when we get staff back in the buildings. So that instructional piece will be there. And it'll be a combination of both asynchronous and synchronous learning. It will be much more robust than it was in the springtime. For those that are thinking about how much work's involved, I got to tell you, there's a tremendous amount of work, and we as an elementary team would not be where we're at without our instructional coaches, our nurses, our special. It really does take a team. I think Nurse Becky said something about that earlier, but it is so accurate because we've been doing this since the day students have left, and so we've been working hard to try to get things in place. I'm just going through and to see if I'm missing anything. You know what? We have about 20 some people left on here. And once again, if you got to go, please go. In fact, I'm going to end the recording right now, but I'm going to stay on and then I'm going to open it up for just questions and I'll do my best to answer them. And if I can't answer it, I'll tell you I can't answer that one. So I appreciate everybody right now. I'm going to stop the recording.
Somebody had asked about